Hello, I'm Siege Tantenko, Puma Podcast, and you're listening to Teka Teka News. Balitang thinking, hindi breaking. In this episode,
there are innovative companies outside that have been bringing femtech solutions and women's health solutions. So my business partner and I thought, why can't we do it here? And why aren't there femtech companies in the Philippines where women are very underserved?
it's been over a decade since the reproductive health law was passed. And despite some gains, there remain many barriers to accessing women's health services. Could technology be the solution?
Hi, I'm Jessica De Mesa. I am the CEO and co-founder at Kindred Health.
Jessica is a registered nurse who worked abroad for a number of years, which led her to question the accessibility of women's health services in the Philippines.
When I got back in the Philippines a few years ago, I was just, stunned by the lack of solutions and lack of options in women's health, unlike in other countries where there's an app for everything, there's a wearable for everything.
Femtech refers to tech-driven products and services aimed at improving women's health and wellness. This includes digital health tools and devices, telemedicine services, and products that address specific health needs unique to women. Femtech, as a term, was coined by Ida Tin, the CEO of menstruation tracking app Clue. Here in the Philippines, the femtech space is in its nascent stages, but local startups like Kindred hope to lead the way.
For the longest time, Filipinas have had so many barriers to access quality care, access to family planning and birth control options, contraceptives, and many other medical conditions that aren't even talked about. There's certainly lack of education and awareness around women's health topics that makes it harder to find quality care. Women's health have been underfunded in terms of research and development and funding in general, and a lot of the problems stem from that.
According to the Philippine Statistics Authority, there were over 53 million women in the Philippines as of 2022. But despite representing half of the population, the health concerns of women are often brushed aside.
For example, 1 in 10 women have PCOS, have PCOS, they call it PCOS, some call it PCOS, it's polycystic ovarian syndrome. There's still no cure, it's not straightforward. If you suffer from PCOS, you have to manage symptoms, and usually that's multiple symptoms. And many women don't even know what PCOS is, or sometimes their family members or loved ones, and we hear these anecdotes from our patients that we see, and they tell us, my mom said, nakikiuso lang ako, or what is PCOS? Like, imbento lang yan. Because, for example, you suddenly gain weight and you don't understand. So it takes a toll on you physically and mentally as well, right? Psychologically as well, like what is happening. And some patients, they experience hair loss or extreme hair growth. Sometimes they break out from acne all over and they don't understand.
Apart from PCOS, common health concerns include endometriosis, dysmenorrhea, and fertility issues. Another barrier to accessing healthcare? Finding a doctor is intimidating.
It's understandable. I've had my fair share of looking for the right doctors, but it's not easy to find. When you walk into a clinic or hospital, there's a long directory of names and specialties, but how do you really know? You just have to go through it and experience it for yourself, right?
And finding an OB-GYN is just the start. Women may need to visit a series of doctors to find the one that's right for them, or with whom they feel comfortable enough to discuss their sexual history and intimate concerns. One way Kindred tries to make this easier is curating the selection of doctors that patients can book through their site.
We try to find the trusted and vetted doctors who are really advocating for women's health. They've published journals on postpartum depression or PCOS, for example. They really champion women in the health sector, and we try to find them and aggregate that and make sure that our patients get quality care through them. We also make sure that whoever we work with, we have to make sure that we're aligned in the mission of providing a holistic level of care and a higher level of care that doesn't have to be expensive.
Through their website, women can book a wide range of services, including OB/GYN and fertility consultations, internal medicine consultations, and immunizations. In addition, they also provide mental health services such as counseling and psychological assessment. We'll pause for a moment, but when we return, we'll talk about other ways Kindred is making femtech accessible to more women. Kindred began in 2021 with teleconsulting, but in late 2022, Kindred also opened their first physical clinic in Taguig. This makes them the first online to offline or O2O femtech company in the Philippines. At their clinic, the roster of doctors include experts in gynecology, dermatology, gastroenterology, mental health and fitness, and so on.
Many femtech companies are focused online and are pure play online, but there are also many femtech companies that produce and develop products like tangible products, physical products, and that includes physical clinics as well. We need that continuity in care. A lot of the consultations can be done virtually, but what happens when you need your injection, your blood work, your ultrasound? As much as possible, at Kindred, we want to control the patient experience end to end, making sure that we follow our patient every step of the journey.
Women's health concerns have become even more pressing during the pandemic. In many places around the world, the long lockdowns and increased burdens at home meant women often put themselves last.
Because of the pandemic, definitely in the last few years, a lot of the reproductive health programs have paused. Some have completely stopped. A lot of public lying-in clinics and nonprofits have also closed, unfortunately. I've seen a lot of plans and I've read a lot of memos from the government that they are going to do or will do. Unfortunately, we haven't seen a lot on the implementation side of things, and I think that's what's important now is, as a community and society as a whole, we should always look into how is the government planning the budget for health.
Creating a healthier future for Filipino women requires a whole-of-society approach. The public and private sector, as well as ordinary citizens like you and me, we can make an impact by listening to the struggles of women around us and encouraging them to seek medical care.
We can't ignore that pain because it can lead to more serious conditions. It's super important not to ignore that pain, and for people who hear this from women, from their friends, from their loved ones, don't shame them, right? Because it makes them more reluctant to seek treatment. Normalize women's health. Normalize getting a pap smear. Normalize getting your transvaginal ultrasound and other checks that you need to do regularly. To be able to help women, we need society as a whole to be able to support that. Not in silos, not just like women helping women. I think we're already starting there. There's already a lot of initiatives for women by women-led companies and all of that, building solutions specific to women. But it's not just the women's community's job. It's everyone else in the Philippines.
And that was today's episode of Teka Teka News. Again, I'm Siege Nantenko. This episode was written and produced by me, If you want to learn more about women's health, check out the podcast Conservative Ako, where Dr. Rica Cruz is currently hosting a series on the state of reproductive health in the Philippines and improving the relationships of Filipino couples by being more open about their sexuality. Just search Conservative Ako on your podcast app. Stay updated with the latest shows and events by Puma Podcast by signing up for our community newsletter. Visit pumapodcast.com to sign up. Maraming salamat po.